But to start, first of all, just introduce yourself and tell us what you do.
Sure. Hi, I'm Sam McLean. I'm an emergency physician and researcher at the University of North Carolina.
Great. Perfect. And tell me a little bit more about what an emergency researcher does.
Sure. So I work in the emergency department seeing patients, and then I also do research on understanding adverse mental health outcomes after stressful exposures. So the kind of experiences that unfortunately we all have in life at one time or another, but car accidents or other types of traumatic events, and how the brain recovers from those, and how mental health difficulties start, and how we can hopefully intervene to prevent some of that in the future.
So building off of this work you do, tell me about how the Heroes Health app started, how you first had the idea and what that initial process looked like.
Yeah, I was working in our COVID units in March and really seeing a lot of colleagues that were under a huge amount of stress. They're living away from their families. They're seeing a lot of tragedy. They're by themselves a lot. They're not really speaking to many folks in the community because they're really sequestered. And it was a very difficult time. And I was seeing a lot of people either, sometimes I would see nurses that would just, for example, or colleague physicians or environmental health services folks who are cleaning the rooms of COVID patients just kind of look like they were having a very hard time, or that I had a nurse colleague once tell me, we were taking care of a COVID patient, and she said, I just need like 5 minutes. And she went and took all of her stuff off and just sat down, and just you could see her just kind of collecting herself and just reaching down and finding the reserves to be able to continue caring for the patient when it was a very difficult situation and a very stressful situation to be in. And so that really got me thinking that our healthcare systems and the way that we work in the emergency department or in hospitals, we're really just communities like any other community. But we were having a time where both the community was under greater stress than it had ever been under before, and also at the same time it was totally fragmented and everyone was isolated from each other. And there was no way for folks in our community who help to support mental health, like our mental health workers and providers, to have any idea how our folks in our COVID units were doing, or how to connect to them to offer support and help. And one particular shift where I saw a particular, a colleague, a friend of mine, who was just crying for a couple minutes, sort of by themselves, and I thought, it would be great to try to do something to help with this really difficult situation. And so I contacted my wonderful colleague, Obie Felton at Google X, and she rallied up support from Google Cloud and so many other parts of Alphabet to be able to come together and do this with them. Was just an incredible adventure, challenge, joy, and it was within a couple months they had built this app on Google Cloud's fantastic platform, and thanks to the work of so many at Google Cloud, we were able to launch in July, and we've been able to, even at our initial site, link up so many people to mental health care and mental health services, including lots of people, dozens of people across our institution and others who were experiencing, substantial thoughts of sadness or even self-harm. So that's been a very rewarding experience.
That's great, Sam. Well, it's so incredible you were able to see this and work on something that can really create an impact right now. Go ahead.
I was going to say, people ask me what the difference, or somebody said to me, how come when a lot of different emergency physicians might have sort of had the same thought or had the same experience, how was it that you were able to do this? And I said, it's because I knew someone at Google, and they were able to rally up the wonderful folks at Google Cloud, and because really it was the partnership, but Google Cloud and Alphabet provided the really critical tech. And not only that, but just the can-do spirit and so many people working extra hours and nights and weekends, and every day and was a new problem and a new challenge. And I was so impressed to see all the folks at Google Cloud and at Alphabet that I interacted with were really, each of them was an owner and a problem solver. And that was, even though it was an extremely difficult series of challenges that we had to overcome, so many challenges on our own institutional side with setting up the cloud, figuring out how to make all the different aspects of it work, and a lot of different technical challenges with setting this up in a short time. What I found was that everybody that I spoke with and worked with would either knew the answer or immediately took ownership of solving the problem and solving it really rapidly. And that just made it incredibly fun. It's really, really fun to work with people like that. And so while it was a lot of work and a lot of extra hours by everybody involved, it was a lot of fun, and the team spirit and the camaraderie and the positivity and the joy that everybody brought to this was really fantastic. And it's one of the most satisfying sort of team experiences of my life. And I'm getting old, and I've done a lot of different, team activities. So it really stood out. Very, very special experience.
That's great, Sam. And so when someone uses the app, kind of walk me through what that process looks like.
Sure. So how the app works is that folks download the app, healthcare workers download the app through the Google Play Store or the App Store. They go through a quick sign-up process, and then the app pushes a survey to them every week. The survey just takes 5 or 10 minutes to complete, and it checks in on people's sleep, their stress, their any feelings of sadness or depression, anxiety symptoms, and any interference with work they're having due to their mental health. And then it gives them a quick summary snapshot report based on their responses to their survey, and it also allows them to see trends over time in their mental health. It also gives them immediate links to crisis services, tech support, phone support, links to other resources. But most importantly, when they sign up, it asks them if they'd be willing to share their information confidentially with a mental health worker at their institution. And then that mental health worker can reach out to them. And so people complete their surveys. The surveys are open to complete Sunday through Thursday. And so then the next day, Monday through Friday in the morning, they're delivered in a summary of the symptom reports of individuals ranked from high to low symptoms. And that allows the kind of outreach that we need a lot more of in this world in general and in every community, and certainly in our healthcare organizations, which is just like, hey, Dr. McLean, I saw that, your sleep hasn't been bad. It's not been bad. It's been bad for a lot of us in healthcare recently. And I don't know if you tried this app, if you tried that app. And every call starts out with a thanks so much for what you're doing. Really grateful for your efforts right now with COVID patients and during this difficult time. On behalf of the organization, I think how often, and I think in general, like how often do any of us get a call from our workplace just thanking us for what we're doing, and at this time that's a really important thing and a positive thing. So I think it basically connects person to person, it connects community member to community member, and it helps us to do outreach, give thanks, give supports, and then help people out who are struggling or suffering with mental health symptoms to be connected to those resources, and at minimum leave with a sense that they're valued, that the community cares about them, and that somebody was checking in on them. And we do this for, it's for anybody on a COVID unit. So we have so many incredible folks in environmental services who are cleaning the COVID units and cleaning the COVID rooms of each patient to make it safe for the next patient coming in. And those folks are working in very heavy COVID areas all day. They often get very little thanks, and they're shouldering a huge amount right now. And doing that day in and day out is stressful, and it's a grind. And so, being able to reach out to those folks is as or more important than any other healthcare worker in our community. And so being able to reach out to everybody from sort of the C-suite to all the folks in the hospital is so important.
Well, that's so great, Sam. And I love what you said about person to person. I mean, it sounds